Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Muhammad Agil Gunawan and my last ID number is 220, and I'm from class pharmacy E. And in here I want to tell you about pharmacokinetic of drugs. And I chose aspirin. Aspirin is a salicylic acid derivative that has antipyretic, anti-inflammatory, and antiplatelet effects. Aspirin is not an actually generic name, but is often thought of as such. The synonym is acetosal or acetyl salicylic acid or ASA, and the chemical formula is C9H8O4. Aspirin works by inhibiting the enzymes cyclooxygenase 1 and 2, and we can call COX 1 and 2, thereby reducing the production of prostaglandin and their derivative thromboxane A2. This has the effects of anti-inflammatory and antiplatelet aggregation. This drug has long been circulating and is one of the most widely used for the counter drugs. Aspirin is usually used as an analgesic and antiplatelet aggregation, for example, in the treatment of headache and acute myocardial infarction. And the pharmacodynamics of aspirin work irreversible through the inhibition of the enzyme cyclooxygenase 1 and 2, thereby reducing prostaglandin production and its derivative thromboxane A2. The effects obtained are antipyretic, anti-inflammatory, and antiplatelet effects. Inhibition of COX 1 and 2 will inhibit the formation of prostaglandin. They play a role in the inflammatory process. Apart from that, it will also inhibit the production of thromboxane A2, which has the ability to induce platelet aggregation. Apart from that, aspirin also has analgesic effects through the central pathway, namely by affecting the pain there's result in the hypothalamus. Even so, the exact mechanism of these effects is still unknown. The onset of aspirin is 5 to 30 minutes, with a duration of action is 4 to 6 hours. Pharmacokinetics. The pharmacokinetics of aspirin starts through absorption to elimination and depends on the type of preparation and the method of administration. And pharmacokinetics of drugs include absorption, distribution, metabolism, elimination, and resistance. Aspirin tablet preparation can be absorbed very quickly in the stomach and duodenum. Extended release tablets are absorbed more slowly and depend on food and gastric pH. Bioavailability of aspirin is 50 to 75%, and the distribution volume of aspirin is 170 ml per kilograms. Aspirin is also widely distributed in the network. At low concentration, about 90% of aspirin is bound to albumin. The higher concentration of aspirin, the lower preparation associated with protein, as well in case of renal insufficiency and pregnancy. In case of aspirin overdose, only 30% bind to albumin. Metabolism of aspirin take place almost immediately after consumption. Aspirin is primarily hydrolyzed into salicylates by esterase enzyme found in the gastrointestinal mucosa. Erythrocytes, synovial fluid, and blood plasma. The hydrolysis result then bind to glycine becoming salicylic acid. And the elimination is the half life of aspirin is 15 to 20 minutes, while the half-life of salicylate will be longer according to the dose of administration. At a dose of 300 to 650 milligrams, the half-life range from 3 hours, while at a dose of 1 gram, the half-life is 5 hours, and 2 grams of half-life is 9 hours. Elimination of aspirin mainly through urine, 75% in the form of salicylic acid and 10% in form of salicylic acid. And the last, resistance of aspirin. There have been a number of reports related to suspect aspirin resistance, generally through case series. Aspirin resistance is a laboratory phenomenon, namely the discovery of COX-1 enzyme activity in platelets despite aspirin therapy. Aspirin resistance is not always clinical meaningful, and I think it's complete enough. And thank you for your attention. Stay healthy guys, and wassalamualaikum warahmatullahi wabarakatuh.